So thank you everyone for joining us today for this webinar, Getting to Technical Excellence in Resilience Programming, Lessons on Cross-Sector Integration in Food Security Activities in Nepal, Uganda, and Ethiopia. This webinar is hosted by the Resilience Evaluation Analysis and Learning, or REAL Award. REAL is funded by the USAID Center for Resilience and was established to respond to the growing demand among both implementer communities and the donor community for rigorous yet practical capacity strengthening support related to resilience. From technical guidance notes to evaluative research reports and capacity strengthening activities, REAL promotes best practice in resilience program design, implementation, monitoring, and evaluation and learning. REAL is implemented by a consortium consisting of Save the Children, Mercy Corps, Tango International, and Food for the Hungry. Learn more and check out our many resources on our website, fsnnetwork.org/real. All right. So again, welcome. And I wanted to just introduce myself first as one of the moderators. Next slide, please. My name is Jill Scantlin. I am the Resilience MEL, which is Monitoring, Evaluation, and Learning Advisor for Mercy Corps, and also a co-author of the paper that we will be focusing on today on integration. I'm going to now pass it over to my colleague Jian to introduce herself.
Thanks, Jill. Hello, everyone. My name is Jian Kim, and I'm a senior resilience researcher based out of DC with Mercy Corps and working with REAL.
All right. Thank you, Jian. So next slide, please. So just wanting to go over, before we jump in, the plan for today so that we're all on the same page about our hopes for this webinar. We're going to take about 90 minutes today. So first, we're going to go over the session norms and do a brief mapping exercise to see where everyone's calling in from. Just as a reminder to everybody, if you're not on mute already, please mute yourself. Next, Jian will give a short presentation on the case study on program integration and provide a common framework for what we mean by integration. I'll then facilitate a panel discussion with two of our colleagues implementing integrated resilience programming to highlight their experiences with and reflections on cross-sectoral integration efforts in Nepal, Uganda, and Ethiopia. We'll then move into breakout groups to have smaller discussions on the challenges and successes that you've faced with integrated programming and where you think we should invest as an international development community to advance our understanding of integration. Next slide, please. Yes, so just a few Zoom protocols to go over before we get started. So like I said previously, it's helpful if everyone could just mute themselves unless speaking. Considering the amount of people we have in the room, this is always a helpful thing to do. And another thing that would be great so we can kind of see where everybody is coming from is to rename yourself and to add your organization along with your name. And so if you hover over your name or photo in Zoom, you can click on a blue box and then you'll see an option to rename. And then you can kind of just place whatever organization that you're calling in from there. That'll be helpful during the breakout groups especially, so we can kind of see what our group is consisting of. Also, please turn off your cameras during the presentation due to some low bandwidth concerns. This will be helpful. And you can use the chat for help or to ask questions. And you can look for those that have tech next to them look for folks on the participant list who have tech next to their name for tech support. So for example, Julia Randall is one of our tech support today. You can send her a private message if you're having issues. Next slide, please. All right, so what you're going to need today. So obviously Zoom, we're in it. We're going to be using that. The presentation and panel discussion is going to be, you're going to be, looking into the Zoom window for that. You're also going to be using Google Slides to do the group work. And so Zubaida has placed the link to those Google Slides in the chat just now. If everyone can click on that to make sure they have access to it. So you're going to want to keep both Zoom and the Google Slides open during the entirety of the webinar. And so once we go to the group work, you'll primarily be working those Google Slides. And this just helps us keep the session interactive. And so just to sort of test out your ability to toggle between Zoom and Google, let's all go into those Google Slides now and minimize our Zoom windows, and then go to the 7th slide in those Google Slides that you should be in by now. And so you'll see a map of the world. I'm getting a note that it requires access permission. Can someone from our team maybe fix that? I think it says anyone who has the link can access. So I'm seeing lots of folks jumping in, so I think it's not an issue. Okay, so if you're all the map of the world, you can see some of those lovely yellow pins. Can you please take a pin and just drop it wherever you're calling in from? We'll just give everyone like a minute or so to do that. All right, we're seeing lots of folks on the East Coast. Not surprising there. We have someone in the middle of the ocean. No, they've moved their pin. A couple of folks calling in from Europe. One pin so far, I believe, in Ethiopia. We have, Australia. Very good. A couple more folks calling in from East Africa. Exciting. All right, well, thank you all for doing that. I think it's always great to see kind of where everyone's coming from. And feel free to keep dropping those pins in at a later point. We're now going to move to the presentation of the real case study on integration. So if you can go back into the Zoom window, this is where you'll be viewing the presentation. And I'll hand it over to Gian.
Thanks, Jill. All right. So as many of you know firsthand, building resilience takes a long-term commitment and an integrated approach to strengthen the capacities individuals, households, and communities to respond to, recover from, and prevent where possible shocks and stresses. What became really clear to us as we embarked on this case study was the glaring evidence gap in terms of what works to facilitate integration and resilience programming that's really rooted in field team members' experiences. With that gap in mind, Jill and I endeavored to synthesize the experience of 2 programs implemented by Mercy Corps. Pahal, the first icon you see there, or USAID-funded Promoting Agriculture, Health, and Alternative Livelihoods, and Margaret Cargill Philanthropies funded NRED program, which stands for Managing Risk Through Economic Development 2. Both of these programs sought to facilitate resilience of rural communities in Nepal through their integrated resilience programming. And while these 2 programs employ different sectors and approaches in their resilience programming integration, evaluations of both programs highlighted the benefit of investing the time and effort to design, implement, and manage integrated resilience programming. And it's on this basis that they were both chosen to be included for this report. Next slide, please. In our limited time together, I wanted to just give you a quick overview of the report's framing, and as Jill mentioned, highlight some common terms so that we're all on the same page to set the foundation for our panel and breakout session today. Motivated by the need for greater clarity and intentionality for designing, implementing, monitoring, and evaluating integrated resilience programming, the study conducted semi-structured in-depth interview and focus group discussions with Pahal and MRED team members at all levels, so regional, field level, and central offices, as well as other Facility Mercy Corps team members and national implementing partners. And the report sought to answer these three questions. First, what is the added value that integration can leverage for programs, their intended outcomes when integration is done well? Secondly, what are the challenges faced by team members in their efforts to integrate their resilience program at the different stages of the program cycle? And lastly, how are these challenges addressed by team members? And what are the strategies they employ to facilitate resilience program integration? And ultimately, the goal of this report was to contribute to the limited documentation of resilience programs' experiences of integration, and also to identify concrete enabling factors to facilitate integration in resilience programs, with hopes of being a practical toolkit for people to pick up and use. Next slide, please. Before we jump into the preview of the findings, it's really important that we get on the same page of what we mean by integration. Thank you. What became really clear in our initial research and in conversations and wading through the many documents in the literature is that there is a need for greater precision in the conceptualization and evaluation of integration and resilience programming. There's a tendency amongst international development and resilience practitioners to refer to program integration loosely and inconsistently. And clarity and standardization in terminology is not just a matter of semantics, but it's really critical, as we found, in facilitating a common understanding of intervention, layering, sequencing, and integration in the context of program design and implementation. So as you can see on this graphic here, in this report, we defined resilience program integration as the intentional layering and sequencing of multi-sectoral interventions, the coordination of actors in order to prevent or reduce the drivers and effects of shocks and stresses that undermine the program and the long-term well-being of target population. You can think of resilience program integration here as an umbrella term that includes both the program layering and sequencing. If you click through, just once, great. The first piece is the resilience program layering, and it's understood as the strategic coordination of interventions across the different sectors, stakeholders, in order to determine which activities or actors are linked. Next, resilience programming is defined as the intentional organization of program interventions to coordinate the order in which activities are implemented and actors are engaged to maximize program impact. Move on to the next slide. As many of you will know firsthand, integrated resilience program requires substantial time and effort to design, implement, manage, and evaluate. And often investment in these efforts is motivated by perceived or real added value of integrated programming over single sector approaches. For Pahal and MRED team members, there were three ways that they perceived integration added value to their programming. First is promoting the sustainability of interventions. Second, ensuring accountability to communities. And third, leading to greater impact. And these three pieces are highlighted in this quote by one of our respondents. First, turning to sustainability of interventions, resilience program interventions promote sustainability through its more holistic approach to addressing community needs. Integrated resilience interventions can help meet the needs of community members while building their trust in the implementing organization and promoting their participation and ownership over their intervention. Second is the accountability piece. Integrated resilience approaches encourage accountability to community members through their intervention prioritization and selection process. For both Pahal and MRED, a bottom-up approach whereby the program could select and design interventions prioritized by community members themselves, based on local needs assessment was central to their integrated resilience programming approach. In both programs, communities played a central role in identifying their own risks and programmatic priorities. And being able to tailor activities to meet community needs and being responsive to those evolving needs throughout the program cycle emerged as a really key component of integrated programming and supported programs' accountability to communities. And finally, it's leading to greater impact. In both Pahal and MRED, integrated interventions were perceived to be better able to address shocks compared to non-integrated approaches, which led to greater effect on community resilience capacities. For example, a main NRED nexus intervention, which included planting sugarcane on riverbeds, which created an income source for community members while also protecting river side erosion, allowed the community members to protect their assets from erosion and flooding. NRED team members also emphasized that there were additional indirect impacts from their integrated nexus approach, such as the reduction of human capital losses from migration, as many of you who are working in Nepal will be very familiar with. And these perceptions that integrated resilience programs lead to greater impact than single sector approaches were borne out, as I mentioned very briefly at the outset, in evaluations of both programs. Next slide, please. Drawing from Paul and MRED's experience, challenges and strategies, this report describes some of the enabling conditions which facilitated intentional integration of these programs' resilience interventions during the different stages of the program cycle. Given our very limited time today, I'll just flag a few of these enabling factors and invite you to dig deeper in our report. First, if you could click. The foundation for program integration is laid during its design, its redesign, and strengthened during its implementation. One enabling factor that emerged from our study is the importance of conducting risk and resilience assessments, such as Mercy Corps' strategic resilience assessment. This is really important to explore the shocks and stresses in target communities, their interconnections, and the social, economic, and ecological systems within which the program is implementing its interventions. In this assessment, it's really key to assess how different community members are differently vulnerable to shocks and stresses, how community members own accounting of their own needs and existing capacities, and the barriers and constraints that they're facing that impede their ability to exercise these capacities and reach their development goals. Next. Turning to program management capacity building, what was loud and clear in our study is that integrated resilience programming demands that team members unlearn their traditional approaches to design and implementation, and instead learn how to carry out tasks in new and occasionally novel ways. One powerful motivator for integrated programming, which emerged in our study, is team members' common understanding of integration and the ways in which it can promote capacities. And what was really critical in this powerful motivator is that this knowledge and technical buy-in could not be siloed at the leadership level, but pervade or is adopted and understood fully by all team members at different ranks. For MRED, integration was central to its resilience approach and commonly understood by its team members and communities. The program's community-based disaster risk reduction approach, the sugarcane that I mentioned in the erosion-prone riverbanks, were intentionally tied to its income-generating economic and market development interventions. This core nexus model, as they were calling it, was then complemented by other interventions such as financial service access, land management, et cetera. And in many ways, it was the simplicity of this nexus model that facilitated MRED team members and communities' understanding and buy-in of its integration approach. And finally, the monitoring and evaluation tools offer a tangible way to monitor progress against program targets, evaluate the effectiveness of integrated resilience interventions, and to inform programs' adaptive management. They also provide a common language by which team members can communicate internally and externally to convey program success. Integrated resilience programs require yet another dimension of M&E, indicators that monitor the ways in which different sectors and actors are sequenced and layered. It is important to think beyond Donor mandated indicators. I'm just gonna pause and request folks mute. Thank you very much. It's important to think beyond indicators that are mandated by donors, which tend to be high level and quite sectorally focused. And for Pahal, the integrated monitoring tool, a set of 14 indicator toolkit, which was developed based on the program results chain, helped team members to track the ways in which community level activities were integrated and were reflective of local contextual context. And although it was introduced later on and was encumbered by some challenges, the IMT served as a really important tool for Pahal's ability to quantify progress towards integration in its resilience programming and to promote reflection and adaptive management of its team members. Next slide, please. So bringing it all together as we transition to the panel presentation, this report drew from the experiences of 2 programs in rural Nepal to inform other resilience-focused programs that seek to intentionally integrate activities across multiple sectors, geographies, and populations within their programming. Given the unique positioning and conditions inherent to Nepal, what's really critical is that similar case studies be conducted across various contexts to build a more comprehensive understanding of what works to design, implement, and manage and evaluate these integrated resilience programming. Our report focused on integration within programs, that is to say, intra-program integration. One area that is especially salient for those working in the resilience sector is how we think through inter-program integration. That is integration across or between programs. Beyond intra-program integration, what does it take to facilitate an intentional integration of programming and interventions across programs? I think is a really key and open-ended question. And finally, insights from these 2 programs highlight the added value of the substantial time and efforts it takes to integrate programmings, yet what works to enable integrated programming in the global context, and to what end, as in what added value and impact can integrated programming have compared to single sector approaches, remain a largely an open-ended question that I think the resilience community of practice should aim to answer. With that, Jill, I'll turn it over to you for panel discussion with Sagar and Mike.
Great, thank you, Gian. So maybe Zubaida or someone can put the link to this paper in the chat. If you haven't read it already, it's a great resource. So I would just encourage everyone after the webinar to take a look. So now we're going to switch gears and move into the panel discussion with 2 of our colleagues who have experience designing and implementing integrated resilience programming for multi-year food security activities. The next slide, please. I am going to let Sagar and Michael introduce themselves now. So let's start with Sagar.
Hi everyone, I'm Sagar Pokhrel. I am the technical director for a USAID-funded DIFSA in Uganda. It's called Apollo Program. Previously, I was working for the Pahal Program that Jill and Jion were talking about as Resilience Director in Nepal.
Great, thank you. Michael?
Hi everyone, my name is Michael Mulford. I'm the Chief of Party of the SPEAR DIFSA in Ethiopia. That's Strengthen PSNP for Institutions and Resilience. PSNP is the government of Ethiopia's Productive Safety Net program. And our program is implemented by World Vision, CARE, and ORDA, and we have learning partners of IFPRI and 2 local universities, Ambo and Hawassa University. And it's implemented in a couple of regions in Ethiopia, Amhara and Oromia regions.
Excellent. So let's jump into the first question for you all to answer. So as we've heard from Gion's presentation, the main thing that distinguishes activity sequencing and layering from typical multi-sectoral programming is that intentionality behind integration. So I want to start out the panel discussion with each of you briefly describing what intentional integration looks like in practice, and providing us with one clear, tangible example from the programs that you have been working on. So let's start by hearing from Sagar. You can move to the next slide, please.
Sagar, you're on mute.
Oh, thank you, Jill,
Thank you.
For the question. So I'm going to take an example of the Pahal program in Nepal, where I worked as the resilience director. So in Pahal, what we have is we have a lot of hilly and mountainous regions, and which has a lot of hill slopes. And again, due to the unplanned construction which happens in most of the like underdeveloped countries, these slopes are highly vulnerable to landslides. And as you might know, that because it's a beautiful country, it has a lot of natural beauty. We have around 6,000 rivers and rivulets in our country, and during monsoon they go through flooding and destabilizes the slopes and causes landslides. So for Nepal, we have like floods and landslides as the major disasters, or SOCs, which we like to call them. I don't know how many people of here are familiar with the community forest user group model of Nepal. It's one of the most sustainable models that we have tried. So it was a no-brainer for Pahal. We work with the community forest user group, and then build the capacity of the farmers to plant broom grass and fodder grass on the slopes. The next question that might arise is, what is broom grass, and why broom grass? For broom grass is a plant species that flowers during the summer season in Nepal, and these flowers, once it matures, are harvested and used in the form of natural brooms. So most of us maybe are using brooms for that are made up of plastic, but in Nepal we are still in the rural settings, we still use the natural brooms. So then for you, the next question, why broom grass? These grasses have the root structures that can penetrate into greater depths and binds the soil structure horizontally to stabilize the slopes and reduce the risk of landslides. Now, coming back to the conversation of layering intervention that Jion was talking about a while ago, Pahal intentionally layered its livestock intervention of goat production and built the capacity of the farmers to support them to collectively work in the groups to plant the broom grass and fodder on the slopes. The fodder allowed the farmers to feed the livestock so that they can build their goats stronger and sell that in the market to access food. In addition to that, there was also a diversified income in the community, as they were able to sell the broom grass in the market. Now the question of how does resilience sequencing look like? Going back to the same example, in order to do slope stabilization as a layered intervention, we recruited natural resource management officers. Similarly, on the livestock side, we hired the agriculture officers. So for every project, a classic mistake that we do is we allow the NRM officer to work in its own space and develop a plan. And same happens on the agriculture side. So this is where the silos start to form, and we all know what happens when silos become big. So in Pahal, what we did smartly was we built the internal platform so that these NRM and ag officers can come together, and then they can discuss about whatever they have planned. So they said they said their plans, whatever they brought up with. Like for example, NRM officers being techie, they say that they wanted to have assessments of the slopes done, understand the types of rainfall patterns in the area, discharge and velocity of the river flowing underneath. They really wanted to understand the science side. Whereas the ag team was more of, they are technical, but then we're also looking from a management perspective of what kind of groups that needs to be formed, what is the agriculture subsector that needs to be worked out, and then what is the type of trainings that we need to give to these with these farmer groups. So once they came together, they actually listened to both of their plans, and then they said, wait a minute, and then paused. And that was the place where Pahal won the battle. That was where the teams were now saying that, okay, how can we now sequence our activities together? And that is where the team were now able to understand that sequencing, and then they were able to go to the field and work with the community so that they can give that same level of understanding to the community. So it was now not a siloed form of activity, but then it was more of a sequenced and layered activity. Now, the last question of what is integration here. So as you said, as it was said by Jion, again, it's the intentional layering and sequencing of multi-sectoral intervention. For this case, the natural resource management, disaster risk reduction, livestock production, and markets. Those are layered interventions. And the coordination of actors. For this case, it was the natural resource management group, which I called the community forest user group, and the farmer groups. They were working together in order to prevent or reduce the drivers and effects of shocks and stresses, which are the floods and landslides for our case. So over to you, Jill.
Great. So Michael, same question. What does integration look like in the programs that you've worked in?
Great. Yeah, I think I'll just take one example similar to Sagar. I'll take an example from our program. Actually, one of the most popular livelihood activities, especially among women, is improved breed poultry production. So we were working with a local private sector actor, Ethiopia Chicken, to enable our rural PSNP clients to access these dual purpose chickens, which produce 4 times as many eggs per year as the local indigenous breeds. And those reared for meat take about 1/4 of the time to reach market weight and sell for about twice as much due to their larger size. Also, proponents of poultry production point to its ability to impact multiple outcomes and describe its low entry barrier, commonly practiced, and relatively low startup and operational costs, its potential to generate ongoing income through egg sales and meat sales, also its potential to contribute to women's empowerment as an activity that's commonly associated with women and with relatively low labor requirement and potential to have increased income for women. And lastly, its potential to improve the nutritional status of children through the increased availability of eggs and meat. So while this activity may have the potential to influence these multiple outcomes, as Sagar was mentioning, in many large multi-sectoral programs, activities are usually slotted under one sector for the purposes of planning, budgeting, management, technical support, monitoring, and reporting. So sectoral staff typically prioritize meeting the targets in their sector, as would be expected. And in our case, this activity falls under our livelihood sector that's really focused on improving productivity, access to markets, and increased income. So in order to tap into the potential of this activity to impact other key outcomes, we intentionally designed the activity with the participation from multiple teams, including those from our health and nutrition team, our WASH team, and women's empowerment teams. And in many countries, when similar programs are evaluated, they find that participating households sell all of their eggs with no change in their consumption of eggs or meat at the household level. So the importance of regular inclusion of animal source foods, especially in the diets of key categories of young children, pregnant and lactating women, and adolescent girls, was reinforced in our program through multiple channels. So this included nutritional messages incorporated in the introduction of the improved poultry production activity in basic groups. That's kind of our village savings and lending. It's called Village Economic and Social Associations, and the actual training of those that chose to engage in this activity. It was also reinforced as well in our other health and nutrition platforms, such as our community-based nutritional promotion sessions with caregivers of underweight children, and at the household level through our timed and targeted counseling with pregnant and lactating women and their spouses. So recent studies, some of which were conducted in Ethiopia, point to the potential risks to child nutrition associated with small livestock rearing, specifically through increased diarrhea and environmental enteric disorder. So increasing the number of poultry also risks increasing exposure of children to animal fecal matter if there isn't a strong WASH component embedded in this activity. As such, our improved poultry production training included important hygiene messages and emphasized as well the use of a nearby hand washing station after cleaning inside or outside the poultry pen, as is kind of demonstrated in this nice picture displayed here. And ongoing monitoring and technical support to these households also includes not just poultry production support, but as Jiyoung was mentioning, we also have checklists that are integrated checklists where we're checking in on these other areas of nutrition and hygiene in particular. So through this integrated approach, we hope to support this activity to live up to its multi-outcome impact potential. And as a small aside before I kind of stop, I just also want to mention IFPRI, one of our learning partners, are leading an impact evaluation based on an experimental design in our operational areas. And there were some promising initial results from our midline along these lines, and while we had our end line was delayed due to COVID, we hope that will be conducted soon, and we'll be able to share some evidence, more evidence with the larger community on the impact of these approaches. Thanks, and over to you, Jill.
All right, excellent. These are two really great examples of that activity, layering and sequencing. So for the next question, I wanted to turn us to the flip side of that, which is, what happens when we fail to integrate resilience programming? So you both work on these complex multi-year food security investments that have multiple sectors and lots of moving parts. So, can you, talk to us about what are some of the potential unintended consequences and potential negative impacts if we fail to integrate resilience programming? I'm going to again start with Sagar to answer this question.
Thank you, Jill. That's a very important question that you've asked. I'm going to give you an example of Pahal Program to explain this. So Pahal is a 41 million food for peace DIPSA that Mercy Corps is implementing in 5 districts of Karamoja sub-region in Uganda. So I'm leading that project as the technical director. So the overall goal of the project is to attain food and nutrition security in the face of shocks and stresses. And in order to attain the goal, the project is working through 4 purposes. Listen to the numbers: 9 technical and 3 cross-cutting sectors, 3 consortium partners, 5 national technical partners, 3 implementation partners, and 1 research and learning partner. We are also implementing through 5 different offices that have more than 200 staffs working for the same project. So yeah. Oh, and one more thing. So the project has been implemented through a market systems development approach and adhering to the resilience framework. Now, I don't know how you feel about that, but then, whenever I go through these numbers, I always say to myself, wow, this is why, Mercy Corps wants to call them these, big DIPSAs a complex project. Anyway, coming back to your, question, what happens when you fail to integrate resilience programming from the very beginning? For a program like Pahal, if that happens, then there is a lack of shared understanding among team members, the team members of 200 people and communities, which are even bigger, about connectedness of system, shocks and stresses, and the potential synergies, within the program logic. So let's go to the slide that you have shown here that, I wanted to take an example of. So for Pahal, when I started working as the technical director, I knew that this was one thing that Pahal needed to take care from the very beginning. So we developed this very simple Pahal program logic and explained to them. We brought all the staffs together, but before entering, asked them to, take off their technical hats outside the room and represent themselves as a generalist. We asked the question to, so what is the highest level goal, which for Pahal was food and nutrition security. We asked them what are the different shocks and stresses that your households actually go through. So this was where they come up with different disasters. We then asked them about to visualize themselves as a Karamojong household and imagine how their household would be affected if these disasters hit them. We then asked the members, what is the household level resilience outcomes that we want the households to achieve? For example, this was where the staff said that they wanted to see first the household producing climate smart diverse nutrient foods, and then they consume those diverse nutrient foods even during lean seasons. This was where the agriculture team, even though I had asked them to leave their hats outside the room, they saw the need of working with the disaster risk reduction and nutrition health team together. In other terms, agriculture team needed to layer and sequence with DRR and nutrition team. The next question we asked was, what are the resources that these households need to have in order to attain the resilience outcome? This was when the staff were able to identify the needs of household having access to human, financial, physical, natural, and social resources. And the same agriculture team member saw the need of now to sequence and layer with the financial inclusion team for the household to have the access to financial resources, and the markets team for the physical resources. The team were then asked a question of why, even if we are trying our very best to provide the access to resources, but the households, after assessing those resources, are not able to use the resilience strategies. This was where they were able to identify the existing social constraints and negative norms that are not allowing households to either access the resources or use the resources to implement the resilience strategies. So going back to the same agricultural team member, here saw the importance of layering gender and social behavioral change. Then we asked our team on who should be providing the services. So, the households need to have access to resources, but who should be providing it? So this was, where, the program team were, they looked at the market systems development approach. So, and then say that this is how, it should be implemented so that it can be attained sustainably. So what we are able to do by sharing this simple Apollo logic was bring all the team together, and so that they can have a common understanding of importance of layering, sequencing, and integration to attaining the goal of the project. So answering your question, Jill, by doing this, we are addressing the potential unintended consequences. Yes, it's an overwhelming yes. By doing this, we are intentionally breaking the silos and disconnected work. We are reducing the time burden for communities, and we are addressing the need of community by working through sustainable models, which will in turn help us build the trust, which is the most important thing for me. Thank you.
Great, thank you so much, Sagar. So I'm posing now the same question to you, Michael. What happens if we fail to integrate resilience program? What is the unintentional consequences or negative impacts that you've seen in your work? It looks like we potentially lost Michael. So I think hopefully he'll be able to reconnect. I don't know if there's anyone else from his team that is still on the call that would like to take this question. Morshed, if you're on. It looks like not. Okay, so I think what we can do now, so we were going to do a brief Q&A. Unfortunately, we are running a bit short on time. And so I would encourage everyone to please put your questions in the chat. We're going to attempt to answer them as we go. And then we can also have some follow-up documentation through. We're going to develop a summary of this event, and we can follow up questions there. I did see one question just come in to the chat now, and we do have about 5 minutes. And so Sagar, maybe we can have you just sort of answer this question now, if that's all right. The question is, could the panelists provide specific examples of the sequencing component of integration, i.e., where there was deliberate strategy to, sorry, the question just left me. So I think the question's just focusing on, yeah, a deliberate strategy for sequencing in some way, and an example of that. So Sagar, are you able to answer that question?
Yes, Jill. So yeah, so it was when we were talking about, so it's more sequencing, deliberate sequencing. So going back to the same example, the way that we did it was, like bringing the team together. So both teams were coming together. So if, like, most of the times what happens is that, the agriculture team, they do their own planning, and then, the NRM team, or maybe, the natural resource management team, or maybe the livestock team, they do their own planning, and then they never come together and have that conversation. So that is where, where Pahal was able to bring these two teams together, and then we're able to say, okay, what is the plan that you're planning to do? So they were able to, like, ask a question of what was that they were doing. And they were able to, like, they were able to share that plan, and then, like, see the potential areas of synergies. How can we, like, do the same thing together? So if it is like forming a group, how, when we are forming a group, are they actually also looking at the natural resource management side? Are they also looking at, for example, the disaster risk reduction side? So are they taking that into consideration in one group? So after forming a group, then what needs to happen? Is it that is it an agriculture related activity that needs to happen, or is it an NRM related activity that needs to happen? So they were able to figure out what actually can, are the activities that needs to be done in a sequenced way, so that they can do that intervention, or do whatever they are planning to do in that community in an integrated way.
All right, thanks, Sagar. So we have Michael back. So maybe, welcome back. We have about 2 minutes left in this segment. So are you able to talk to us about what the potential unintended consequences are, or what happens if we fail to integrate in your experience in your program?
Sure, and maybe I'll just cut it short. Sorry, apologies, I had an internet and power outage there. But yeah, just actually listening to Sagar, I was just making me smile. We also have similar challenges integrating not just across multiple departments within our program, but also across multiple government ministries and partners in implementing the PSNP, as well as other USAID partners that are working in our areas and having important need to coordinate and sequence and layer activities, for example, with Feed the Future partners, where we're overlapping in geographic areas, as well as health and nutrition with Growth Through Nutrition and other partners. But yeah, maybe just to briefly perhaps tag on to the last example I was sharing, if there wasn't this strong hygiene component integrated into the activity, we may have actually caused child nutrition to decline as a result of increased poultry production. And I didn't touch on this a lot in my earlier comments, but if there wasn't a strong message both for men and women in VESAs and at the household level about the critical nutritional needs of key groups such as young children and pregnant and lactating women, the men may have not supported their wives to increase the preparation of eggs for meals in the home, or allowed the increased income to be used to purchase diverse food ingredients for improved nutrition of young children and pregnant lactating women in particular. I could share more, but if you want me to save time, I can just stop there.
Yeah, thank you so much. Yeah, I think that's a really great illustrative example. And, I think in the breakout room, we can explore more things from, or more aspects of your experience. So thank you so much and I'm glad you got to hop back on there. All
Sure.
right, so we're now going to move to the group work section of this presentation, of this webinar. I would really encourage folks to stay on, because I think this is where the most interesting kind of collaboration and cross-learning and discussion happen. And so we're going to then move back into the first presentation that we had up. Let's give Julia a moment to load that. All right, just next slide. Okay, so again, just wanting to remind folks that we're going to be working in those Google Slides. Hopefully you have those open still. Zubaida gave us the link again in the chat in case you jumped on late to the call, so please go ahead and click on that. Everyone should be able to access that, I think, as long as you can access Google Docs and Google products in general. So here's how the group work sessions are going to work. So everyone's going to be assigned to a Zoom breakout room. They're going to be named based on a color, and you're going to just pay attention to what color you're in. So either blue, green, yellow, orange, or red. You're going to get a prompt that's going to tell you to enter the room, and just accept that when you see it. In the breakout rooms, if possible, you can keep your camera on. It helps to make the interaction a little bit more natural. And then unmuting yourself, and you can even hide self-view, so you're not looking at yourself talking. That can help to support the interaction as well. We're going to have about 30 minutes for the group work, and we'll let you know when you have about, either 10 or 5 minutes left, and there'll be then a prompt that gives you 60 seconds when the session is ending. Next slide, please. So for the group work, we're going to answer two main questions. The first is, where in the program cycle have you faced challenges and or been successful with integrating programming? And so we're going to have a space for sticky notes, and I'll show you that in a minute, where you can write your ideas and kind of put it along this spectrum of success or challenge, and you can align it with the different stages of the program cycle, if that's helpful. We'll then move into the second question, which is, where as a humanitarian development community should we invest our resources to advance understanding of how to integrate programming to catalyze resilience and sustain well-being? So after you've heard, the presentation, thinking about your own experience, where you really think we should invest and kind of move this forward, this conversation, understanding the operationalization of sequencing, layering, and integration. So next slide, please. Just going to go through a really quick example of what some of the successes and challenges could look like based on an experience from Pahal, and maybe what we would want to promote discussion of in the breakout rooms. So Pahal, which is the program in Nepal, found that orienting their team structure and work planning process around separate technical sectors caused a fractured approach, activity fatigue among participants, because they were going to several trainings. And so one of the challenges to integration, I think, is team structure and how it's oriented around sectors. And so that might be something I'd put around the challenge side, and maybe around the setup and planning is when you're kind of getting your team structure together. So Pahal eventually realized that they could reorganize their teams around where these sectors naturally aligned. And so you'll see, like, for example, the ecological system, which was one team, held several of the technical teams in there, like NRM, natural resource management, the earthquake response, emergency, water, and disaster risk reduction. So they reorganized their team, and the work planning was done jointly across these cross-sector teams. And so success for something that promotes successful integration would be, I think, joint work planning and cross-sector team organization. So just kind of an example of some of the things that we would be interested in seeing on these group work slides. Next slide, please. We're now going to exit out of, I just wanted to kind of show everybody what the slide decks look like. You'll see sticky notes here and these little stars, which are ways to prioritize, but your group facilitator will kind of walk you through this once you're in your group. I think now is the time in which we're going to enter the breakout groups. So yes, please look for that prompt and then accept once you see that, and we'll go to our breakout session now. Right, so hopefully everybody is coming back into the main session here. And maybe, Julia, we can project the synthesis slide now. And then if anybody, the red group, it looks like you're slacking here. Don't see any points, key takeaway points there. So if you're able to put some of those, and apologies if the instructions weren't clear, it was for the second question, what we want to invest in as a international development group to move forward our understanding of integration or operationalization of integration. So I will go with what we have here to kind of give kind of a synthesis or overview of some of the main points. Looking like, so from the blue group, it looks like investment in building evidence, and then through governance, policy, and market systems. So needing to, there's a couple other results on the need to build more evidence. And so specifically the yellow group called out additional research and policy recommendations on integrating between programs. And so I think we have limited information on how to operationalize integration, or even just some studies on it beyond individual impact evaluations, but usually those focus on within the same program, how is integration improving that impact. And now I think we need to move to looking at the between program integration. So thinking about especially that nexus between humanitarian development, peace building programs, so improving that integration there. So yeah, and again, in the green group, inter-program integration more challenging than intra. So yes, the between program integration looks like there's some calls for more work there. How does integrating work in practice? We need documentation that's practically done, more practical tools and guidance for integrating activities during the startup specifically. Looks like there are some calls there for those practical tools and guidance. I know the paper that Gianna and I worked on very much was providing a conceptual framework for what is integration, what's the value of integrated programming, what are some of the challenges and enabling factors. But what we really do need and what practitioners do need is those practical tools and guidance. And I think particularly during that startup period when it's like the moment to get it right, and to set those cultural norms around joint work planning, or to set up even your how you're doing your assessments, to have those be integrated. There's a lot of space in the beginning that is important. So I'm seeing some more things coming in here now. Coordination is vital to ensure a targeted approach. Very true. We have a long sticky note here about developing a community of practice to help that coordination. I think that's a great idea, and having that be supported by our donors and other folks. Don't overcomplicate it. The logistic difficulties associated with getting field teams to work together. I think that's a great sentiment, and I think that kind of comes back to the practical guidance. We don't overcomplicate it. Let's make it more practical for our teams. Co-creation is key. Possible to document best practices. I agree. Maybe through some kind of community of practice, having an inclusive space for co-creation, I think, is essential. So we're at time. We thank you all for joining us today. I want to just appreciate everyone who stayed through the whole webinar and then participated in the group work. We're going to be taking all of your ideas. We've recorded things, we have note takers, and we have this PowerPoint where we have all of your ideas, and we're going to synthesize that into a summary report, hopefully pretty soon after today, and send that out through various channels. We also would appreciate if you could take just 2 to 3 minutes to fill out an evaluation event. It really helps us to better prepare for future events that you'll be participating in, to understand what worked, what didn't work. So thank you all. The link to that SurveyMonkey is on the screen. And yeah, I hope you all have a wonderful day or night or evening or wherever you are in the world. So thank you so much.